This project is about supporting patients with heart failure to manage their own condition better at home. And the background to this is that current models of healthcare delivery really don't focus on the time that patients spend in the community. And so there's a small period of time that patients spend in hospital, but after that they tend to be on their own with some scattered reactive visits that they have with their own doctors. What we are asking them in this study to do is to do some simple monitoring of their health status at home, which takes about 1.5 minutes per day, where they tell us how they feel, how is their breathing, how is the quality of life, and then they measure their blood pressure and heart rate and weight. And we use that information to proactively monitor these people, minimizing the risk of people deteriorating to an extent that they require admission to hospital.
So I was first diagnosed in 2011. I just had what I thought was just like a throat virus and a bit chesty, same sort of thing, like everybody else in the office had got. Anyway, it got progressively worse, and obviously I went to the doctors a few times, and I went up for a chest x-ray, and that's when they sort of said that I got heart failure, and my heart was enlarged and valves were leaking, all sorts of things were going on. That was one of the visits to the heart failure nurse that they suggested the trial, which I totally wanted to go for. Even if you're not experienced with computers or laptops or anything like that, once it's been shown to you, it is so easy. It's just touch screen and do what you have to do, whether it's blood pressure or your weights. For me personally, the system is just really reassuring to know that someone's looking at it. You know, you have panic days, and you know that someone's monitoring your heart and that type of thing from the other end, from the readings, and it is total reassurance.
So what is unique in this study is also what happens with the data that has been collected. What we're trying to do is here to collect the data all in one central place and use advanced computer analytics to discover patterns in the data for individual patients and to be able to better predict who is likely to deteriorate. The long-term hope for using technologies to facilitate healthcare delivery is that, in particular for people with chronic conditions, we're much smarter. Patients are much better, they're empowered to look after their health in their home environment instead of having to be admitted to hospital. So ultimately living better and longer. And that hopefully will also have implications on healthcare provisions and payers. By providing a more proactive care, we can reduce the risk of expensive hospitalizations and premature death that has got significant impacts and cost implications for healthcare provision as well as the economy as a whole.